Hey there, and welcome to a deep dive into the world of sickle cell disease. You've given us a really in-depth study guide, and we're excited to break it all down. We'll pull out the key takeaways, and you'll be ready to impress at your next journal club.
It's going to be quite a journey. You know, what's interesting about sickle cell disease, SCD for short, is that it's not just one single thing. It's a whole group of disorders. And it all comes down to these tiny little, well, they're like the workhorses of our circulatory system, our red blood cells.
Okay, before we get into the nitty-gritty, can you set the stage for us? Your notes mentioned that SCD is a genetic disorder, and genes are like the instructions for building our bodies, right? So what's going wrong with the blueprints in SCD?
It's all about how your genes control the production of hemoglobin. Hemoglobin is a protein, a really important one. It's inside red blood cells, and it carries oxygen throughout the body. But with SCD, there's this, well, a mutation in the gene that makes a part of hemoglobin. It's called beta globin. And that messed up gene, it produces this abnormal hemoglobin. It's called hemoglobin S, or HbS.
HbS. Got it. That acronym seems important. Can you break down why that one tiny letter change makes such a difference?
You're right, the little things matter. See, normal hemoglobin HbA, it's like a well-built cargo ship. Flexible, efficient, great at transporting oxygen. But HbS, it's like those ships were made with cheap materials. They're more rigid, and under the wrong conditions, they clump up. And I mean, they really distort the entire red blood cell shape.
So that's where the sickle part of sickle cell disease comes in, like those crescent-shaped cells you described in the study guide.
Exactly. Picture a normal red blood cell. Smooth, kind of like a donut. Now imagine that cell morphing into this stiff sickle shape. And just like you wouldn't want a bunch of clunky ships trying to navigate a tight canal, these weirdly shaped cells, well, they create a lot of problems in the bloodstream.
Now, before we get into all of those problems, and your notes definitely go into detail there, you also mentioned that there are different types of SCD, so it's not a one-size-fits-all kind of thing, right?
Absolutely not. You've got the most common type and also the most severe, sickle cell anemia. It's also known as HBSS. What that means is someone inherited 2 copies of the sickle cell gene, one from each parent. But then you have hemoglobin SC disease, or HBSC, where you inherit 1 sickle cell gene and 1 gene for a different hemoglobin variant.
Okay, so different combinations, different levels of severity.
Yeah.
And you also mentioned sickle beta thalassemia, which is a mouthful.
That's one way to put it. Basically, it's inheriting the sickle cell gene, but also a gene for beta thalassemia, which is another blood disorder. That one reduces hemoglobin production. The severity really depends on how much normal hemoglobin the body can still crank out.
Wow, so we're already seeing that SCD is way more complex than just one condition. And since we're on the topic of different types and inheritance, that's where genetics gets really important, right? You really highlighted how SCD is passed down. What do we need to know?
You're right. Understanding the inheritance patterns is key. So SCD is what's called an autosomal recessive disorder. Autosomal just means the gene for SCD is on one of the numbered chromosomes, not the sex chromosomes. The recessive part is important, though. That means a person needs 2 copies of the mutated gene, one from each parent, to actually have the disease.
So you could inherit just 1 copy of the sickle cell gene and be a carrier, but not actually have the disease itself.
Exactly. And oftentimes, carriers have no clue they have the trait unless they get tested. That's why genetic testing and counseling are so important, especially when planning a family.
So with SCD being a genetic disorder and one that's more common in certain populations, there has to be a historical and geographical aspect to all of this, right? I know you brought up a fascinating link to malaria in your study guide.
It really makes you appreciate the complexity of biology. We see SCD most often in places like sub-Saharan Africa, the Mediterranean, India, places where malaria has been or still is a huge problem. It turns out that having just 1 copy of the sickle cell gene, having sickle cell trait, can actually protect against malaria.
So it's like a biological trade-off. In areas with a lot of malaria, this genetic adaptation became more common, even though it carries its own risks.
You got it. Genetics and environment all intertwined over generations. It's not as simple as 1 gene equals 1 disease.
Okay, so we've got the genetic factors down, but what's actually happening within the body? Your guide uses the term pathophysiology, how SCD actually impacts things. Can you walk us through that?
Of course. We talked about how the mutation in the HBB gene causes the production of this weird hemoglobin, the HbS. When oxygen levels are normal, it behaves itself. But when oxygen levels drop...
Those clunky ships we talked about earlier start causing trouble.
Right. When oxygen gets low, HbS starts sticking together, forming these long, rigid fibers inside the red blood cells, almost like magnets all clumping up.
And that clumping forces the red blood cell into that stiff sickle shape. I'm guessing stiff, sticky blood cells don't flow well.
You're catching on quickly. Imagine those cells trying to squeeze through the tiny blood vessels all over your body. It's a recipe for blockage.
Like trying to put square pegs in round holes. It's no wonder your notes mention vaso-occlusive crises.
It's a domino effect. Blocked blood vessels mean tissues are starved of oxygen, and that equals pain. Intense pain, vaso-occlusive crises. And to make matters worse, the sickle cells are more prone to dehydrating, making them stick together even more.
This is really painting a picture of how big of a deal one gene mutation can be. Before we get to those long-term complications, though, what happens to the sickled cells? They don't last as long as healthy red blood cells, do they?
They don't, unfortunately. They're fragile, break down easily. Their lifespan is way shorter. This constant breakdown is called hemolysis. And hemolysis leads to anemia, a major characteristic of SCD. Plus, all those leftover bits from the broken down red blood cells can damage blood vessels and cause inflammation.
So we're talking blockages, cell breakdown, inflammation, and those are just the initial effects. Your study guide really stressed understanding this chain reaction with SCD.
It's crucial. And these are just the basics. The long-term consequences of SCD are even more serious.
We'll definitely dive into those. But for our listener who love those practical takeaways, what's the biggest point about how SCD actually works in the body?
The biggest takeaway, SCD is all about these cascading effects. One gene mutation sets off this chain reaction that impacts the whole body.
Which makes early diagnosis and management that much more important.
Absolutely, we'll get to that. But for now, let's move on to the next part, those long-term complications of living with SCD. Get ready, it's about to get real.
Okay, so we've covered a lot of ground already, really getting into how SCD works at the molecular level. But our listener is all about those key insights, those so what moments. And you highlighted some pretty heavy long-term impacts in your study guide.
Absolutely. We've talked about those stiff, sickle-shaped cells clogging up blood vessels, and the anemia from the shortened lifespan, the inflammation. Now imagine all of that happening again and again over years. It takes a toll.
A toll on the whole body, it seems. Stroke, for one, really stood out in your notes. It's pretty frightening to think about.
It's a big concern, especially for children with SCD. Remember, those sickle cells block blood flow. Well, if that happens in the brain, it can cut off oxygen, causing a stroke. And even a small stroke, especially in a developing brain, that can have lifelong effects.
It's a harsh reality. And on top of that, you mentioned something called a vascular necrosis, which sounds pretty ominous, if I'm being honest.
Yeah, it's not pretty. It basically means bone death, those blockages we keep talking about. They can happen in the blood vessels that supply the bones, too. We see it a lot in the hips, the shoulders, leads to chronic pain, trouble moving, sometimes even needing joint replacements.
So on top of everything else, you have this potential for debilitating joint problems. Really shows how systemic SCD is, how widespread the effects are.
Exactly, and it doesn't stop there. SCD also affects the vital organs: kidneys, heart, liver.
You mentioned that kidney problems are particularly common. What's the connection there?
Well, think about what the kidneys do. They filter waste, excess fluids, all from the blood. They need a network of tiny blood vessels to do that. And those tiny vessels are prime targets for blockage by sickle cells. Over time, that leads to chronic kidney disease. And in serious cases, people with SCD might even need dialysis or a kidney transplant.
Wow, those are some serious interventions. It's clear that SCD isn't just about managing pain during a crisis. It's about preventing long-term damage throughout the body.
100%. And, we focused on the physical side of things, but your study guy also made a great point about the psychological and emotional impact.
That often gets overlooked, doesn't it? Living with a chronic illness affects every part of your life.
Exactly. Living with unpredictable pain crises, the hospital stays, always worrying about complications. It takes a toll on your mental health, your relationships. That's why mental health support, in addition to medical care, is so essential for people with SCD.
Treating the whole person, not just the disease.
Right. And thankfully, there's more awareness about that now than ever before.
So we've covered some pretty tough realities of living with SCD. But before we move on to treatments, those glimmers of hope on the horizon, I want to back up for a second. Our listener is all about practical takeaways. How is SCD even detected in the first place?
That's a great question. Early intervention is key. Thankfully, lots of countries have newborn screening programs now.
That's amazing. They can catch it right away.
Yep. They take a tiny blood sample from the baby's heel and test it for that abnormal hemoglobin, the HbS we talked about. It's a simple test that can make a world of difference.
That's incredible. But what about people who weren't screened at birth? Or adults who might be worried about SCD? What tests are there?
The gold standard is a blood test. It's called hemoglobin electrophoresis. It separates the different types of hemoglobin in the blood so doctors can see if the HbS is there.
So it's like a fingerprint analysis for hemoglobin. Pretty cool.
It is pretty neat. Doctors might also look at a blood smear under a microscope just to actually see if the sickle cells are there. And then there's genetic testing, especially for families with a history of SCD or for couples who want to have kids.
Right, knowledge is power, especially when it comes to making decisions about family planning and your health.
Absolutely. Speaking of knowledge, we've got a lot more to cover. Your study guide gets into the details of SCD treatment, management, even cutting-edge research. Ready to explore that.
I'm ready for some good news. All right, we've really dug deep into the complexities of sickle cell disease, the genetics, the challenges. But, in your study guide, you highlighted the incredible advances in treatment and management. I think we could all use some good news right now.
I'm happy to deliver some good news. It's true, living with SCD can be incredibly difficult, but things are changing. Researchers are constantly developing new weapons to fight this disease. We're talking about real improvements in the quality of life for those who live with SCD day in and day out.
You mentioned before that there's no magic bullet cure for SCD, not yet at least. What are the go-to strategies for managing the disease right now?
One of the most important things is staying ahead of the game, especially when it comes to infections. Remember how SCD can weaken the spleen. The spleen's a key player in the immune system. People with SCD are more likely to get infections.
Makes sense. It's about being proactive.
Exactly. Vaccinations are so important. And those everyday things like hand washing, avoiding sick people, simple things can make a huge difference.
Prevention is key. But what about when a crisis does hit? How do you manage those really painful episodes your notes described?
You're right. Pain management is crucial during a sickle cell crisis. Over-the-counter pain relievers might work for milder pain, but often you need stronger prescription medications.
You mentioned opioids before, and I remember your study guide talked about using those types of medications for severe pain.
It's tricky. Opioids, they work well, but there are risks. Doctors have to monitor their use carefully. We're talking about a careful balancing act. Other things that can help during a crisis include IV fluids for dehydration, oxygen therapy if oxygen levels are low, and in some situations, even blood transfusions.
Blood transfusions, that sounds pretty intense. How does that help?
It's kind of like hitting the reset button. It gives the patient a fresh supply of healthy red blood cells, the flexible kind that can carry oxygen without any problems. The goal is to dilute those sticky sickle cells, ease those blockages, and give the body a break.
It's like a real lifesaver during those critical moments. But are there any long-term strategies? Anything to prevent those crises from happening in the first place?
There are, and this is where things get really interesting. One medication that's made a huge impact is Hydroxyurea.
Oh yeah, your notes mentioned that one. A big development in managing SCD.
And for good reason. Hydroxyurea actually helps the body produce fetal hemoglobin. That's the kind of hemoglobin babies have in the womb. And get this, fetal hemoglobin. It doesn't sickle the way adult hemoglobin does.
So it's like tricking the body into producing a type of hemoglobin that's less likely to cause issues?
You got it. Pretty clever workaround. And studies show it works. Hydroxyurea can really cut down on the number and severity of pain crises, and it lowers the risk of other complications, like acute chest syndrome.
Amazing. Are there other medications out there that work like hydroxyurea?
There are some promising new ones. One is called L-glutamine. It seems to protect red blood cells from damage. Another is voxelotor. Voxelotor makes it harder for hemoglobin to sickle. It's like putting a shield around those red blood cells.
It's encouraging to hear about new treatments like that. It sounds like the focus is shifting from just reacting to symptoms to trying to actually modify the disease itself.
Exactly. And speaking of pushing boundaries, we can't forget about the research happening in gene therapy and bone marrow transplants. These areas offer the potential to cure SCD.
Those were two areas you were really excited about when we first discussed this deep dive. What makes them so promising?
Well, gene therapy and bone marrow transplants both aim to replace those faulty stem cells, the ones that produce those troublesome sickled red blood cells. It's complicated, but it could be a cure. Imagine a future where SCD isn't a lifelong sentence, but something we can fix at its core.
Now that's an incredible thought. And you mentioned CRISPR technology earlier. That sounds like something from a sci-fi movie. Where does that fit in?
CRISPR is like a tiny, precise pair of scissors that can edit specific genes inside cells. It's revolutionary. With SCD, researchers are trying to use CRISPR to actually fix the gene in a patient's blood stem cells. Then they transplant those edited cells back into the patient, where they could hopefully start producing healthy red blood cells.
So it's like editing the body's instruction manual. Yeah, that's mind-blowing. What about bone marrow transplants? How do those work for SCD?
Similar idea to gene therapy. You replace the patient's bone marrow, where blood cells are made, with healthy bone marrow from a donor. That healthy marrow would then take over the job of making red blood cells. Only this time, they'd be those nice, flexible cells that can move through the bloodstream without any trouble.
Makes sense, but I imagine finding a matching donor can be a real challenge.
It can be. It's like finding a needle in a haystack. But there have been breakthroughs in using half-matched donors, like a parent, which could make this a possibility for a lot more people.
That's fantastic news. Between gene therapy, bone marrow transplants, and these new medications, there's a lot to be hopeful for.
Absolutely. And don't forget, there's ongoing research into even more effective ways to manage pain, to prevent infections, and to address the many complications that come with SCD. There are a lot of bright minds dedicated to improving the lives of people with this disease.
It's inspiring to see that kind of dedication. So as we wrap up this deep dive, what's the most important message you want our listener to take away from all this information?
I want them to know that even though SCD is a tough disease, there's hope. A lot of hope. With research and these amazing advancements in treatment, the future for people with SCD is brighter than ever.
It's about arming ourselves with knowledge, advocating for continued progress, and holding on to that hope. And speaking of knowledge, you, our listener, deserve a huge round of applause for joining us on this journey into such a complex topic. We hope this deep dive has given you a good understanding of SCD, sparked your curiosity, and maybe even inspired you to keep learning.
Absolutely. Keep asking questions, keep exploring, and remember, knowledge really is power. There are some amazing organizations doing fantastic work on SCD, and we encourage you to check them out if you want to learn more.
Well said. Thanks for joining us on this deep dive.